Hi, my name is Qiaoxin, and this is my student ID card. My student ID is 2212165. So today I will present nursing management of an embolic stroke, a case study of Mr. Teresita Manola. This is 3 a.m. in ED, and the light is harsh and the air is tense. Mr. Manola, a grandmother, is hushed in, she's confused, her speech is slurred, and she can't move her left side. In the critical moment, before the full medical team come, the first person by her side is a nurse, and in the nurse's hand lies a powerful tool, the A2E assessment. So today we will walk through the critical night. We will explore how as a nurses we use approaches to become the first and the most crucial line of defense for our patient. The first part is A2E assessment, which is enable nurses to quickly identify and managing life-threatening condition. Also, which is step-by-step approaches. First part is airway. Her airway is patent, and because her GCS is 12 out of 15, she's now at the risk of the airway blocking if she loses more alertness. And the slur speech also shows her tongue and throat muscle are weak. She's on the oxygen via Hudson mask, which is shown on the picture, at 6 liter minutes with a saturation oxygen 95%. Increase the concentration of inhaled oxygen to improve the cerebral oxygen supply and prevent hypoxia brain damage caused by the stroke. Keeping her sitting upright in semi-flower position, which is in the blue picture, the right angle helps her breathe easier and keeps the airway clear. So nurses should stay alert for the saturation or choking. So the second is breathing. Her breathing rate is 26 beats per minute, which is tachypnea, and the breathing shallow as well means she's working harder to breathe. And the air entry is equal but a bit reduced at the basis, maybe from lying in the bed. A nurse needs to listen her chest and make sure her oxygen stay above 95% to avoid the brain hypoxia. And next is circulation. Her heart rate is 132 beats per minute, which is tachycardia, and the blood pressure is 170 and 95, which is hypertension, shows her heart is under stress, and her artery fibrillation is not controlled. Her feet is puffy and cold, shows the poor blood flows. Continue ECG and BP monitor as needed. Before giving the medication, her blood pressure must stay below 185 and 110 to prevent bleeding in the brain. So next is the disability. Her GCS is 12 and she has left-sided weakness, facial drooping, and slur speech. And nurses should check the GCS, pupil, and limb movement often, and call for the help if her score is dropped by 2 points or more. Her BGL is 5.5, which is fine. So the last part is exposure. She doesn't have a fever or any wounds, and her IVC left the cuticle fossil. She's on Hamas fluid at 20 mL per hour. Because her weakness, nurses should reposition her and protect her skin. Give the prior administration of heparin, a full blood count, and kill coagulation screen, and the electrolyte panel are routine to assess the feasibility and the risk of the thrombosis and anticoagulation, which is shown on the picture. This is like all the routine blood test. Overall, the A2E assessment shows her airway is at risk and her heart is stressed and her brain is affected. Then the nurses focus on keeping her airway open, oxygen up, blood pressure stable, and notify the stroke team. And for the question 2, there are 4 high priority nursing intervention I wanted to talk about. So the first intervention is maintain airway and oxygen. Miss Manola decreased the level of consciousness, and the slur speech suggests reducing the airway protection. So the nurse should position her in a semi-flowers position. provide oxygen with Hassan mask, and assess her swelling reflex. If the aspiration rates increased, suction equipment or the advanced airway support must be prepared all the time. So this action shows keep the airway clear and prevent further brain hypoxia. And the second one is close neurological and vital sign monitor, which is monitor GCS, limb movement, speech, and pupil every 30 to 60 minutes. Report to any deterioration or airway compromised. Early recognition of neurological decline enable timely escalation and prevent secondary brain injury. And the next one is blood pressure and circulation management. Hypertension during the acute stroke can help maintain cerebral perfusion, but excessive evaluation increase the risk of the hemorrhage. So the nurse should follow the medical order to lower the blood pressure gradually. And while monitoring the heart rhythm and also for the peripheral perfusion, this is support adequate the circulation and minimize the complication. And the last intervention is preventing complication. Because of the left-sided weakness, Miss Manola is at risk of the pressure injury, chest infection, and deep vein thrombosis. Regular repositioning and good skin care and the use of the compression stocking or gentle limb exercise are essential. So this strategy maintain the comfort and promote recovery. And for question 3, I choose heparin IV infusion, metoprolol 50 mg BD, and pantoprazole 40 mg daily. So first medication I want to talk about is heparin IV infusion. Heparin is an anticoagulant prescribed to prevent further embolic event in artery fibrillation. And nurse must assess for active bleeding, recent surgery before start therapy. Administer via infusion pump to ensure the right dose, and also perform APTT monitoring every 4 to 6 hours to maintain the therapeutic range. Observe for bleeding sign or gum bleeding. If APTT over the range, stop infusion and notify the doctor. And the second medication I want to talk about is metoprolol 50 milligram. Metoprolol, which is a beta blocker, helps control heart rate and blood pressure. Prior to the administration, check the blood pressure and the heart rate. Hold the dose if the heart rate is under 60 beats per minute or the systolic blood pressure is under 100. Monitor for dizziness, fatigue, and educate the patient not to stop the drug suddenly, as it can cause rebound the hypertension or tachycardia. And the last medication I want to talk about is the pantoprazole, 40 milligram daily. Pantoprazole is a proton pump inhibitor that helps prevent the stress related to tricuspid ulcer, especially in stroke patients on anticoagulants. But before the administration, check for the allergies and also evaluate for the symptom of GI bleeding. It should be given before the meals for the best observation. And also monitor the side effects such as headache, diarrhea, abdominal pain, and also the long-term use rates like hypomagnesemia and vitamin B12 deficiency. And as a conclusion, so for Mr. Manola embolic stroke, needs quick and well-organized assessment and promote nursing care. Using A2E approaches assessment help guide what to do first, keeping her airway clear, making sure she's getting enough oxygen, supporting her circulation, and carefully watching for any change in her neurological status. And the main nursing intervention including managing her airway, giving oxygen therapy, close monitor her neurological sign, control her blood pressure, and also getting her ready for any possible thrombosis treatment. And when giving the medication like heparin, metoprolol and pantoprazole nurse must be assessed very carefully, giving them safely, and also watch close for any side effect it will happen. Putting all the action together helps her recover fast, lower the risk of the complication, and follow the Australian National Stroke Care Standard. Thank you. And now this is all my reference. And thank you so much. Thank you.